What's Up? Doc Mike. Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for April 9, 2021. The challenges facing health departments. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Harassment online, harassment in person, threats of violence, and even violence itself. In the last year, amid the pandemic, public health workers have experienced more direct attacks than at any time in the previous century. I'm Lindsay Smith-Rogers, producer of Public Health on Call. This week, as part of National Public Health Week, we're bringing you a special 4-part series with episodes excerpted from a webcast from last month. The webcast was produced in collaboration with the Association of State and Territorial Health Officials, known as ASTO, the National Association of County and City Health Officials, known as NACHO, and the Big Cities Health Coalition. In this series, we will explore the extraordinary challenges facing the field of public health in the COVID era. We'll hear from health officers on the front lines about their experiences, from researchers about the scale of the problem, and from the leaders of ASTO, NACHO, and the Big Cities Health Coalition about what is to be done. In Part 3, we hear from Dr. Sarah Cody, Jennifer Katanis, and Lisa Macon-Harrison about what they've seen in terms of harassment and how to counter it, as well as solutions and investments needed to protect public health workers so that they, in turn, can do the job they signed up for, to protect the public's health. Then, Dr. Josh Sharfstein talks with Dr. Joni Caldoun, the Chief Medical Executive and Chief Deputy Director of the Michigan Department of Health and Human Services.
Thanks to you all for joining me. I'd like to start first with Dr. Cody. Could you tell us about how you see this challenge of harassment of public health officials during the pandemic?
Thanks. It's really a pleasure to be with you and to get to tell a little bit of this story. I would say that my overwhelming emotion is it just makes me feel sad. A year into the pandemic, I'm still experiencing rather regular harassment. It comes in the form of people coming to protest at my home, letters written in the paper, emails, other letters that are quite, way outside the norms of what we would consider kind of normal discourse and differences of opinion.
And you're not alone in California in experiencing these challenges.
No, I know that many of my colleagues have also experienced this. I think that for whatever reason, I may have experienced it a little bit more intensely. I've actually had a 24/7 protective detail for almost a year because of concerns about my safety and the safety of my family, which is not something I ever would have expected going into public health, where we're usually the behind the scenes people.
Now, Director Katanis, you are the president of the National Association of County and City Health Officials. You hear stories like this, I'm guessing, from around the country. We just heard some of the data. What goes through your mind?
I mean, certainly as a public health professional and the president of NACHO, this is incredibly disheartening. Many of these folks that have lost their positions and or have been marginalized are people that I've held in the highest regard. They're public health professionals, they're scientists, well respected among their partners. And they didn't go into this work because they wanted to hurt people. They went into this work to protect the public's health and have everyone's best interests at heart. So to recognize that in some parts of the country, they are being challenged, they are being threatened, is really just incredibly disconcerting and upsetting.
Director Harrison, I want to turn to you. Could you help put this in context? This is not just harassment happening while everything else is, going perfectly smoothly for the public health sector. What's the context for this?
Yeah, so we're all navigating uncharted waters. We're in the middle of a public health pandemic that has lasted a year. We're dealing right now with supply and demand issues around vaccine distribution, and people have a lot of emotions around that. We also have all of the responsibility and very few of the resources to do a lot of what the public expects. And so doing our very best work takes a whole lot of public service fortitude and dedication. It doesn't necessarily come with a lot of funding, and people have a hard time understanding sometimes why things can't move differently or faster in this vaccine response. We also have an infodemic. We've talked about that across the course of the last year, and understand that with social media and with high emotions around politics, we just have a lot more static to temper than we've ever had before. And it's hard to stay focused on the messages that we want people to hear.
So this harassment is happening in the context of a lot of misinformation, incredible demands on public health, and a legacy of disinvestment and inadequate resources in many places.
Absolutely.
So go back to you, Director Kurtanis. What do we want to see in terms of support of public health officials? How do you counter this harassment?
Sure. So, two things. One, I feel very fortunate that I have the support of my municipal officials in the geography that I live in. That really insulates me from some of the harassment that others have experienced. So, that's important. But I think if there's one lesson that we've learned in this pandemic is the impact of long-term disinvestment in our public health system. So people don't understand what it is that we do, the value and the importance of local health departments. And that leads to a lack of recognition of who we are as public servants, as scientists, as public health professionals. So we need to be thinking forward about reinvesting in our governmental local public health at all levels so that we can rebuild that trust and understanding of the value and the importance of the work that public health departments do and who their public health leaders truly are.
Thank you. Now, Dr. Cody, I know you have written regular long messages to your community, some of which get passed around all around the country. And I know people who live in your county who are so impressed with the work you're doing, the way you think through these difficult challenges. What has gotten you through this difficult period? And are there any lessons there for what can be done to better protect public health?
Well, as difficult as it has been for me professionally and personally, there are many, many, many bright spots. And I would say chief among them is that in Santa Clara County, we've transitioned from the public health department being one little department sort of doing public health work off in our rabbit hole off to the side to a fulsome whole of government response to the pandemic. And so I feel fortunate, for example, that every single day I sit with a county executive of this huge county and the county council and many other county leaders, and we think through together how to navigate the pandemic. And that's not the kind of support and collaboration that I had, a year ago or 2 years ago. And that's fantastic. That is really fantastic. And so that's what's gotten me through. I think it's really with anything, when you feel that you're part of a community of people with the same shared values and same shared mission, it fills your bucket and keeps you going. And that's really what's kept me going.
So I'm certainly hearing from both of you that it's critical to have the support of community leaders, other public officials, elected leaders for public health to be able to navigate through these choppy waters. I want to ask Director Harrison about the kind of investments that are necessary to really strengthen public health and put public health in a better and more resilient position for the future.
Yeah, that's an excellent question, and one I hope many, many leaders across our nation will also chime in on and grapple with. For us right now, the mainstay of the work we're doing is our workforce. So the public health workforce is just incredible. And just as Dr. Cody talked about her bucket being filled by the common good of community support and partnership, I think equally the evidence of hard work and dedication of our public health workforce during this pandemic has just been incredible. we need to honor the work of public health nurses and all of the people coming together to do this really taxing job right now and showing what they're made of. It's been really incredible. I think the other thing we really are sorely lacking and need investment in is a data infrastructure. We talk about being able to tell our story, but the most effective way to tell our story is with data. And oftentimes at a local health department level, our data are collected and sent in to different places. So we collect a lot of data, we share a lot of data, but we don't always own and tell our own story with data because our systems are quite rudimentary and need some upgrading in big ways. We've learned that through the need for a simple hotline at the moment where I have 25 of my 82 staff across this 2-county rural health district answering the phone every day, getting 15,000 calls for vaccine appointments. We would love to be able to do that better, faster, stronger, but would need, an extra $10,000 a month for a new computer server in order to make that change. These small, relatively simple change to private investment becomes really Herculean for public investment. And we've got to figure out a different way so that we can respond in the way that our people know how to respond and honor them.
Got it. So, Director Kurtanis, is it fair to say from your perspective that addressing the crisis in public health right now is both about protecting health officials from harassment and threats and recognizing the value in public health and providing real investments for improvements in the future?
Yeah, I think there are lots of lessons in this pandemic about, the implications of disinvestment in our public health system. If we do not take this opportunity to learn from those lessons and build a robust public health system, but rather continue to just fund emergencies, we will have done nothing really to improve governmental public health.
Great. Well, let me, first of all, thank all of you for your incredible service to your communities and to the field of public health through your leadership and for joining us today to talk about these important issues.
Thanks for having us.
Thank you for having us.
Thank you.
Next, Dr. Josh Sharfstein talks with Dr. Joni Khaldun about the fallout of harassment towards public health officers and what might be hopeful signs from the new administration.
Dr. Khaldun, thank you so much for joining me to talk about this really important issue. You have been with the governor in Michigan since the very beginning of the pandemic through so many different challenges, so many ups and downs. Michigan has done extremely well, and I know that your actions have saved many lives in the state, but could you tell me what this has been like for you personally?
First of all, thank you for having me on today. It's been a challenging year, but it's also been an incredible honor to, quite frankly, help save lives in my home state of Michigan, state that I love. Us in public health, we've been working on this well before anyone knew what COVID-19 was and before anyone knew what contact tracing or social distancing meant. So it's been a long past 12 months, but I'm very proud of my team at the Department of Health and Human Services and many others, local health officers, businesses, others in state government who have really stepped up and helped us be so successful in Michigan.
Now, we've heard stories today about health officers who are getting threats, harassment, and dangers that they never anticipated taking the job. Has that been an issue in Michigan?
It's been quite concerning. I've seen this play out nationally in the state of Michigan. I know people saw this where our governor had her life threatened. I certainly have had people who have said very unkind things to me, sent me letters that were pretty scary, that made me think I had to get law enforcement involved. I've seen terrible things on social media, things not just about myself, but also my family and my children, which are incredibly concerning. And it's unfortunate that as public health officials, we are just trying to do the right thing and save lives, but it's become very political. And sometimes, I wouldn't call it the norm, but sometimes people's behavior is really unfortunate in this setting.
I know you've been in public health for a while. Have you ever experienced this kind of situation?
I have never experienced this type of situation and never imagined that I would have to. When people go into public health, they do it really because they just want to do good work and save lives. I certainly never imagined I'd be on TV most days either. But I never imagined I'd have to be worried about my own safety or the safety or privacy of my family.
Now, we're hearing that there are a number of health officers around the country who have just said, I can't do this anymore. And I wonder if you're seeing some of that in Michigan as well.
There have been some local health officers who have retired. I don't want to say exactly why they have, but we are seeing in Michigan and across the country, as you mentioned, that people are choosing this time to step down. And I think it's unfortunate. I think we're losing a lot of leaders, a lot of public health expertise. And I also am concerned about the pipeline, the next generation of public health leaders, those who will be leading local or state health departments, what they're seeing, what they're watching, and hoping that they still want to be local or state public health leaders, given what they see as far as how a lot of health officials have been treated.
How related are some of the challenges in staffing and equipping local health departments to do some of the critical tasks of public health right now?
That's been one of the most challenging things. I think everyone, including us in public health, we've been advocating for staffing and funding and resources for decades. But unfortunately, a pandemic has hit and we are not properly funded or resourced to be able to respond in the way that the public rightfully wants us to. So even from the beginning, identifying cases, getting our data systems up and running, being able to publish our data in the way that people want it to be. People were very surprised that it's not just a click of two buttons and we can release all of this data. We always want to be transparent. We always want to explain to the public what's happening, but our data systems just don't allow that. And we don't have the staffing. So I think that's been something that's been very difficult and has contributed to the fatigue, quite frankly, of a lot of not just public health leaders, but just public health professionals in general.
So it's frustration at doing the job with the meager resources that are available, plus this incredible new challenge of harassment, threats, and other dangers.
Absolutely. I say the threat of harassment and also just the pressure. Everyone, the media, everyone wants us to be perfect and fast. And quite frankly, we want to as well. But when you're under-resourced and again, you add the harassment to it, it does make it very challenging.
Now, we are at a moment in this country, we have a new administration. We have a new focus on science and public health. And I wonder what you think the opportunity is to undo some of the situation that we're in and these challenges that we've been talking about. Do you envision a different future for public health than the present that we're in right now?
I'm really excited about what I've seen from the Biden administration, the elevation of science. We're seeing briefings on a regular basis where we're being told the truth from the White House. It's just incredibly refreshing to see. And so I think there's an opportunity for us to really elevate and remind people of the importance of public health, bring science to the forefront, have scientists, medical doctors, experts really speaking to the public directly. I think there's a great opportunity. But also, we really have to focus on the infrastructure and making sure we are building out the resources, staff, the data infrastructure so that we can get through this pandemic, but of course, also prepare for the next one and other public health threats that, quite frankly, have not gone away, whether it's maternal infant health, lead, other environmental health challenges and threats. We need to build our public health infrastructure, and now is the opportunity to do it.
And as far as this harassment and threats, how do you think we might be able to, if possible, put a lid on the real terrible things that we've seen in recent months?
I'm hopeful that some of the politics that unfortunately has become front and center across the country and really put fuel into the fire, if you will, when it comes to how people talk about public health officials and talk about each other, quite frankly, even people with different political views. I'm hopeful that, again, from the White House, we are seeing more responsible language. We're bringing everyone together. And I think there's a real opportunity for us to move forward in a way that does not make public health be political, which has been really unfortunate throughout this pandemic.
So it's respect for public health, it's resources for the infrastructure, and it's ultimately a united front against COVID.
That's right. We're all in this together. And if we work well together and respect scientists and experts and public health leaders, we will get through this pandemic and we'll end it even more quickly. So I'm really hopeful and optimistic that we can do it.
Dr. Khaldun, you're a hero to me and to so many others. Thank you so much for joining me today.
Tomorrow, in the final episode of this series, we'll hear some specific calls to action in terms of solutions to the challenges facing public health departments across the country.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.